we were discussing this when we were talking about the spinothalamic and the dorsal column tract. That if you have a lesion on at the level of key 4, below the level of key 4, what type of sensory loss you are going to expect. So because the dorsal column below T4 is representing the same side of the body, so you lose two-touch discrimination, vibration, and proprioception below the level of the lesion on the same side. While you lose the lateral white column is basically representing the fibers from the opposite side of the body. So below T4, you would lose pain and temperature and cool touch and pressure on the opposite side. What happens with C1 damage? So we were talking about the corticospinal tract, and we said that corticospinal tract, most of it, 85% of it is crossed at the level of the junction between the medulla and the spinal cord. So if you have a lesion at C1, the corticospinal has already crossed. So what you would expect is that below C1, you would, if you have damage at C1, below C1, you would have an upper motor neuron lesion on the same side of the damage. So can you explain the upper motor neuron and the lower motor neuron? So if you have damage to the white matter column, the motor tracts, you have an upper motor neuron lesion, because these are the corticospinal fibers which are going down to the lower segments of the spinal cord. If you have damage to the interior gray horn cells, or the spinal nerve itself, or the cranial nerve nuclei, which is supplying the motor supply to the head and neck, or the cranial nerve itself, it is called lower motor.
Thank you, Doctor.